to those who are joining by live stream. Yes, this is being live streamed, so just know that, but I hope it won't in any way impede the kind of frank conversation that we hope we can have in this room, led by a very able moderator. At Vital Strategies, we believe that every person ought to be protected by a strong public health system, and that is our vision and what we work towards. Today's event on addressing air pollution and the NCD response is critically important and integral to that vision of ours. Air pollution, as many of you in this room know, contributes to around 5 million deaths each year, and that's nearly 1 in every 10 deaths. It's the 5th leading risk factor for mortality worldwide, and the economic costs to the global economy are about $255 billion in lost labor income and over $5 trillion in welfare losses. These are obviously enormous costs. I'm doing the easy part today, which is just to introduce each of the people that you see before you, and then our very able moderator, Dr. Sophie Gumi, will be doing the moderation and pushing people to make tough comments and ask tough questions, including yourselves at the end. So let me start by introducing her briefly, and you know that you have the bios on the flyers that we sent out and we've provided today, so I won't read the entire thing, but let me just highlight them by saying she is a team leader on ambient air pollution at the WHO. She oversees air pollution statistics and reporting and is responsible for implementing the WHO work plan on ambient air pollution and health. She also works towards enhancing the evidence for policymakers and building country capacity to address air pollution and its health impacts. We're really delighted that you could do this today. Thank you. Let me then introduce next Nina Renshaw, who is the Director of Policy and Advocacy at the NCD Alliance, where Nina leads the NCDA's global policy and advocacy work. For more than a decade, she's been engaged in a range of international policy areas, including the environment, transport, industrial policy, taxation, and health. And prior to joining the NCD Alliance, when we're very lucky to have her there, she was based in Brussels as Secretary General of the European Public Health Alliance. I'd also like to introduce Dr. Salaban Omar. He's the Senior Advisor for HIV, Health and Development at the United Nations Development Program. Dr. Omar has over 20 years' experience in health program management in Africa, Eastern Europe, and Central Asia. He's currently a Senior Advisor at UNDP HIV, Health and Development. He's also involved in UNDP's Solar for Health program, where he oversees the development and implementation of health sector access to renewable energy. I think our other speaker is not yet here, no? So I'll hold off on introducing him. So Dan Cass, my colleague Dan Cass, is the Senior Vice President of Environmental Health at Vital Strategies. Dan's illustrious public health career has spanned government, academia, and civil society. He's been largely focused on reducing the burden of environmental disease in urban populations and has a team of epidemiologists, environmental scientists, and risk communication experts who work with government and civil society to address air pollution, heavy metals, and other toxic exposures. And even though he's not here, I'll just get his introduction said to you so that you know who he is when he arrives, and we'll tell him that we've already introduced him. Sri Lav Agarwal is the Joint Secretary for International Health, the Ministry of Health and Family Welfare of India. Dr. Lav Agarwal is an officer of the Indian Administrative Service and has worked in various capacities over the last 2 decades, including as Director of Intermediate Education and Commissioner of Health in the government of Andhra Pradesh. He's presently posted as Joint Secretary to the Ministry of Health and Family Welfare. So Dr. Gumi is going to obviously lead us off on a discussion about the impact of air pollution on health, economies and development, and the steps needed to address air pollution as part of the global NCD response. After the panelists have spoken, we will open the floor to questions from the room, and then hopefully we'll continue to have a robust discussion until the time ends here. So thanks all very much for coming, and Dr. Gumi, over to you.
Good afternoon. Thank you very much for inviting WHO to moderate this interesting side event. We'll briefly describe the plans of WHO on addressing air pollution and health issues. So as we speak, there is a side event during the World Health Assembly for the launch of a global health and energy platform of action. The vision of this platform of action is to accelerate the transition to clean energy to improve health and livelihoods. How and why we do that is because we want to strengthen the political and technical cooperation between the health and energy sector through a multi-stakeholder platform that will gather government, civil society, UN, and the private sector. The initial focus of this energy and health platform will be on clean cooking and also electrification of healthcare facilities, because this is essential to deliver good quality care. This platform is led by WHO and by UNDP, together with other key stakeholders, very active in the energy domain, like the World Bank, ARENA, Sustainable Energy for All, the United Nations Foundations, and also the Clean Cooking Islands, but also many others. The idea is to build a mechanism for enhanced cooperation among the health and the energy actors through the establishment of this multi-stakeholder health and energy platform of action. This EPA, this platform of action, has three main objectives. The first one is to really mobilize high-level political and financial attention with commitment to support energy access. The idea is to compile a group of champions that can really advocate, raise awareness, and really try to mobilize finance and attention. A second objective of this platform is to build a consortium of energy and health practitioners to provide direct support to countries. WHO and UNDP are very well placed because they have countries' offices. So the idea is really to really support countries with a direct link to technical cooperation, also again with a wide range of different actors. And third, the platform will develop and disseminate a set of health-targeted communication materials, focus on clean household energy and electrification for healthcare facilities, aim at local communities, building on existing raising awareness tools that, like, for example, the Breathe Life from the WHO and the other UN agencies, but also the work from other partners. WHO has been advocating since decades now on household air pollution. This is something that is very important for our agency and also for our Director General. And there is a lot of technical work that has been done and will be really disseminated through this platform. That's the idea. A second topic I'd like to present to you is the WHO Air Quality Guideline. As you know, WHO sets guidelines on air pollutant level, and the WHO Air Quality Guideline is currently being updated for classical pollutants. This is a very long process, very rigorous process, and it has started in 2016. The result of the guideline, the new guideline, will be most probably published next year. When this guideline will be published, WHO will be teaming up with the key stakeholders to mobilize the health sector to disseminate and really try to implement as much as possible those guideline values. The process to update other guidelines which are related, like for example the Indoor Air Quality Guideline for household fuel combustion, the process will be started to update those guidelines as well once the new one will be published. Third activity that is very dear to WHO is the capacity building material for the health sector. Since the World Health Assembly resolution and the roadmap on air pollution, there is really a need to develop health training material for the health sector, because they need to get the knowledge, they need to get the tool to really advocate for air pollution and health. And this is something that is going on right now. The target audience is not only public health, but it's clinicians, it's community health worker, and everybody in the health community that has a direct access to patients, but to the population, and also to other stakeholders that can really advance the agenda. On other activities, 2 months ago, WHO convened an expert consultation on risk communication for personal level intervention, like face mask, indoor air filter, the benefit of doing physical activity, in air pollution settings. And this was a very interesting meeting where evidence was reviewed, and there was experts were providing advice on how to communicate this to the public and to patients, because it's complicated. It's not, the evidence is not necessarily there to derive recommendations. So this was a first milestone towards trying to advocate, to educate the public on what to do to protect health. And finally, WHO is now working on the 5-to-5 matrix to tackle NCDs, now that air pollution is finally recognized as a risk factor, and we are really working with a wide range of actors to deliver a menu of policy options and cost-effective interventions. Thank you very much. I guess we will start with Lina? No? While we wait for Dr. Awad.
Thanks, Sophie. Good afternoon, everybody, and welcome. Thank you for being here. It's a pleasure to see you. As Sophie said, my name's Nina Renshaw, and I'm Policy and Advocacy Director at the NCD Alliance. So we're delighted to be here, and we're really pleased that this week we're going to see that shift to the 5x5 approach for non-communicable diseases cemented. So air pollution is being added, it's being recognised as a major risk factor for a whole range of NCDs. We've just published a policy brief on the disease impacts of air pollution. You'll find a few copies out there, and if you were watching, especially the British media last weekend, you'll have seen an awful lot of coverage of that. That was born of a research paper that's been published by FIRS, the Federation of International Respiratory Societies, and the headline was really that air pollution affects every organ in the body. It's maybe not just the most obvious physical impacts that we can feel ourselves, but it really, at the cellular level, it gets to every organ in the body and is doing maybe a lot more damage than what we may initially realize. So I think that was a great scene-setting piece for the discussions that the decision makers are going to be having to take this week. As we all know, the death toll of air pollution worldwide is around 7 million, which puts it on a par with tobacco as a risk factor for NCDs and premature mortality. Air pollution obviously doesn't discriminate. There's 90% of us around the world, almost everybody, live in areas where the air quality is unacceptable, basically, and it's putting our health at risk. The great news about NCDs in general is that to some extent there are tried and tested solutions. We know what policy measures work to tackle, prevent and control the NCD burden. And we know which ones are cost effective. These are called the best buys. They're in Appendix 3 of the Global Action Plan on NCDs. And thanks to a decision that we've taken here this week, there's going to be an opportunity to expand that list also to include the best buys and the recommended policy interventions for air pollution, which is great news. The best buys that we already have on the list, if they were implemented around the world, these are things like tobacco policies, things like policies to curb obesity. If we would just implement those around the world, we could save 9 million lives by 2025. 9 million, and that's without introducing anything on air pollution. So imagine what we have to save. It's absolutely incredible. So that 5x5, the defining list of recommended interventions, I think for air pollution, we know already what the top candidates are going to be for that list. We have measures around the world that have been tried and tested in different resource contexts, both for indoor and outdoor air pollution. I think we should get used to the idea that that list is going to be a long one, because you need a whole recipe, a whole menu of different policy solutions for different contexts. And also that list shouldn't be set in stone. As we're trying things in the process, as we get the evidence base of what's cost effective online, we need to be able to add to that list continuously as well. Obviously what we're talking about is systemic policy change. It's not about these end-of-pipe solutions, people wearing face masks or taking, buying air filters or whatever for their homes. It has to be systemic. It has to be upstream solutions. I think what's absolutely essential to remember is it's not just the stuff that we might think of off the top of our heads, industry, power generation, transport being the most obvious ones, but we absolutely mustn't forget agriculture, which is one of the major contributors both to climate change and air pollution everywhere in the world. In parts of the world where we've done quite a lot about transport and energy already, vehicle emissions standards, power plant emissions standards, national emissions ceilings, which have worked well, that means that relatively the share of agricultural air pollution is rising pretty dramatically. So it's important to think of the things that might be out of sight, out of mind. So agriculture, waste, and the way we deal with our waste, shipping, aviation, part of the transport sector, but also our shift to digital economies. I mean, all of this doesn't come for free in terms of emissions. While we're on heavily fossil fuel-driven energy supplies, all of this is driving the air pollution burden as well. I think the message also that I want to leave you with is that as part of the best buys, we have some recommended interventions which are fiscal measures, so tax, sugar, alcohol, and sugar-sweetened beverage taxes. Now, we have to add into that range of measures to expand the fiscal space, which might also be increased fiscal space to fund UHC. We have to include fossil fuel taxation in there as well. We have to tax the things that are damaging our health in order to make maybe some more space for things that can help our health. So whether to earmark or not to earmark, that isn't something that will be discussed here. These are obviously national level discussions, whether you want to put the dividends from taxation to UHC or not. There's been some tried and tested experiences with this around the world. Some of these have worked better than others. And an important message is don't count on stable revenue. Don't become hooked on this as a revenue stream, as has happened in some countries for tobacco. Because if your tax works well, people will consume less, buy less, and your revenues will diminish. So don't start counting on this as something that's going to be a fixture, a staple of your revenue generation. So as a final thought, I think we have some high-tech and we have some low-tech solutions. We have solutions across all different kinds of resource contexts. These are very cost-effective. We're increasing that evidence base all the time. Investment cases can come online relatively quickly. What we need to make sure is that our cost-benefit models there can deal with massive co-benefits across other sectors. Obviously climate, but also social co-benefits, livable communities, road safety where we're doing things about transport and active mobility, personal safety where people, women, children can get out more safely into their communities and exercise as well. And maybe local measures can also increase some city self-determination, and we can get some really interesting experiences there from London, from Kigali, where there's a car-free day every month, from Medellin in Colombia, where there's bike paths and so on. There's a huge range of things we can do. And we also have to think about all of this in comparison with the costs of inaction, which are completely, off the chart, and we're learning more and more about these every day. So we're not comparing to business as usual, we're comparing to a future where more and more people, more than 7 million every year, are going to die from the impacts. Thanks.
Thank you very much, Nina. This was well said. And now I would like to welcome Dr. Sri Agarwal, who arrived, and I invite you to join the podium, please.
Distinguished delegates, diplomats, ladies and gentlemen, at the outset I am really sorry that I was slightly late to join this place, and as is typical of finding solutions, you realize that you are just running round and round and you still do not find what is most relevant and probably the easiest of the solution to find. So I was actually taking 3 rounds of this same building and campus, and I could not locate this building. So I think it sums up very well in terms of probably knowing solutions till why we are not able to achieve, in terms of what we should be doing and how we should be doing. So I'm really sorry that I was late, and my gratitude to Vital Strategies as well as the Non-Communicable Disease Alliance for taking up this agenda of putting air pollution at the center of public health agenda, something which is very vital, and in context of variety of problems in the health sector we are dealing with, something which gets often neglected because we probably do not see the impact of this as an immediacy, and we try to talk more in terms of programmatic interventions in various other diseases which we encounter. There are problems of air pollution related with both indoor as well as outdoor, and as we are all aware that it is about industrialization, urbanization, depletion of forest cover, agriculture practices, high energy demand for the highly populous country, particularly countries like India with a population of around 1.3 billion. And so with these as the challenges in front of us, with these as these causes in front of us, it is very important that from India perspective, which is what I would like to sort of highlight today in our discussion, that we are also equally committed and concerned on the aspects of both mitigation as well as adaptation within the constraints of our limited sources, and to work out with respect to ensuring healthy lives for our citizens. We actually had initiated working on air pollution probably at the highest level when we had a high-level task force on air pollution, which is headed by none other than the Principal Secretary to the Prime Minister's Office, and the Ministry of Environment, Forest and Climate Change is actually the nodal ministry under the environment pollution category, and they are the nodal ministry. And under the Environment Protection Act, we actually had an environmental authority in the year 1998 which was started, and we had taken a few initiatives which also include, I would just like to cite out National Clean Air Program, National Ambient Air Quality Standards, coming up with a National Air Quality Index, National Air Quality Monitoring Program, then graded response for highly polluted cities in India, primarily Delhi and the National Capital Region in and around Delhi. We had also come up with 42 specific points to mitigate air pollution in major cities of this country, and also indoor air quality guidelines, biomedical waste rules for India. We also sort of realized that beside the outdoor air pollution, for us, indoor air pollution, household air pollution is also equally important an area to work on. And with this being an objective, there is a momentous step which was taken up by the Honorable Prime Minister of India on 1st of May 2016, when we launched Ujjwala Yojana. Ujjwala is, in Hindi, it means shine. So in this Yojana, in this scheme, we try to provide LPG connections to 50 million below poverty line families of India. Then the scheme aims to replace unclean cooking fuels, mostly used in the rural part of this country, with a clean and more efficient LPG. Delegates, as part of this commitment, we have also come up with, from the Ministry of Health, as a National Action Plan for Climate Change and Human Health, and National Center for Disease Control is the nodal agency to take up this activity. And we are also coming up with the steering committee, which is headed by a senior colleague in the ministry, which is Additional Secretary of Health, who has multi-sectoral representation in terms of what action needs to be done on the issue of air pollution. We started understanding and trying to create evidence on the air pollution and its effect on health, in terms of that since November 2017, in and around hospitals of Delhi, we do daily surveillance of acute respiratory illnesses in context with the air quality index of this particular town, so as to understand and create required evidence. We have issued required advisories to the National Center for Disease Control on air quality index and the steps to be done accordingly. And we are trying to now increase the surveillance in 20 most polluted towns in the country, so as to create the evidence and identify the adaptation measures. We, through the Indian Council of Medical Research, have also started a multi-site analysis, which is effect of outdoor air pollution on acute respiratory symptoms in Delhi. Also, health impact assessment in 20 most polluted cities, and a zone-based study has been initiated. There is also an effort in terms of creation of center of excellences. 10 such center of excellences have been identified in the country, through which we are trying to identify health adaptation plan, be it related with vector-borne diseases, be it cardiovascular diseases, etc., so as to understand the linkages as well as the interventions which needs to be done at the field level. I would also like to highlight that the major focus primarily is in terms of getting all ministries on board, and as you would all kindly appreciate, it is not only Ministry of Environment, Petroleum and Natural Gas, Transport, Agriculture, as well as the local administrative bodies, which all need to come together, and we need to identify the source of pollution and sort of take specific measures in terms of controlling that. Major corrective actions are also now in implementation phase, like for example, checking pollution from construction sites, brick kilns, power plants, improvement in public transportation like metro and air-conditioned bus, advocating vehicle pooling, promoting cycling, walking and other modes of transports which require less energy, ensuring mechanized sweeping of roads, controlling in terms of burning crops and biomass, etc. So these are few of those international practices which we have put in place, and I would in the end only like to highlight this is a challenge which collectively we have to take. I look forward for again, guidance from international experts, if not today, again over a period of time, in terms of how we can collaborate together, learn from experiences of each other, and can make a meaningful impact into this sector. Thank you very much.
Thank you very much, Dr. Agarwal. This was very inspiring, and India is leading in many things, and congratulations for all those efforts. And as you say, governance is a difficult issue. Now I invite Dr. Daniel Kass, please, from Vital Strategies.
Hi, is that better? Hi. I'm so delighted to be here, and thank you all for coming to this event. We organized today's event in part to mark the transition of the World Health Organization's 4x4 that describes key health outcomes and their risk factors to now include a fifth outcome and a fifth risk factor. Of course, mental health and air pollution being the fifth risk factor. So I want to reflect in my remarks for just a few minutes on what, now that air pollution joins its evil siblings of food, physical inactivity, and alcohol and tobacco, what we've learned from the experience of trying to address those, and what will, I hope, accelerate action to rapidly and really substantially reduce emissions and exposures. So the first lesson that I want to highlight is that there are culprits in this fight. It's taken a long time for the global public health community to fully embrace the implications that many of the leading risk factors for non-communicable disease are actively promoted. The food industry, alcohol industry, tobacco industry, among others, are some of these culprits. Addressing the health consequences of these risk factors or exposures can't succeed without changing their behavior, as well as the behavior of policymakers and the public's tolerance for it. The successes from, for example, the framework on tobacco and the progress being made with the Healthy Cities movement helps us chart a path for how to address air pollution. And while the causes and the contributors to harmful air pollution differ by location and in the proportion of what the specific sources may be, we know globally that combustion is the leading cause of death and disability. In areas with the greatest population density, of course, it's the practices and promotion of harmful and dirty fuels for heating, cooking, energy production, transport that are principally responsible. And in rural areas, as you've heard, agricultural practices that promote land by clearing by burning and burning of crop waste endanger children, accelerate disease among adults, and contribute to climate change. Many of these industries actively sow doubt of science, they lobby for the status quo, and they intentionally confuse policymakers and the public to prevent actions that will require change to their commercial and their industrial practices. The second lesson I think we've learned is that the solutions must be both local and international. Cities and nations can make really substantial progress by diversifying their energy toward greater renewability. They do and can invest in public transit. They may regulate local emissions. They can invest in waste collection that prevents urban burning of waste. They can promote distribution systems for cleaner household fuels. But we can't forget that there are global forces at work, and there must be global action. Whether that's a set of global goods for technical assistance and financial assistance to countries and cities, or whether it's the fact that we have to leverage more of the global climate funding for initiatives that have near-term benefits on emissions, we have to think internationally as well. And one other piece that I think is important, there's a real need for an international platform for corporate responsibility that will have to be demanded rather than just willed into existence. We need a global coalition to prevent manufacturers and multinationals from exporting from their home countries what cannot be sold or used there. High sulfur heating fuels, poorly manufactured or maintained cars without modern emissions controls or safety features, second-hand and retired diesel trucks, buses, and vehicles that pollute our cities, transport our children. Another lesson is, like alcohol and tobacco, personal decisions matter, but air pollution is a classic externality the result of a market failure that fails to take into account the full societal and health costs of emissions. People cannot make personal decisions to eliminate the use of coal in power plants. They cannot choose to take public transportation where it does not exist. They cannot cook with electricity where there is no grid. And we cannot expect the market to solve this problem on its own. The lesson from high-income countries is that regulation and legislation drives these changes, and it's critical that the global public health community do what it can to support these efforts in country and in major population centers. The next lesson is that we must educate the public and change the discourse about air pollution. At Vital Strategies, we recently published a report called Hazy Perceptions, which are out in the front, if you haven't grabbed one. We analyzed more than 500,000 social media posts and news media stories about air pollution in 11 countries. And I invite you to read the full report, but a few highlights are noteworthy. Public and journalist discourse about air pollution overwhelmingly discusses obvious, but not the most important sources of emissions for air pollution. They focus on acute rather than chronic health effects. They rarely discuss solutions, and they obsess about daily variation rather than continuous exposures. And I might note that health-based messaging currently around air pollution only encourages this by focusing on air quality and disease rather than chronic health impacts. We have to reorient this discussion, or there will be little demand for truly health preventive policies. People engage more when air pollution's impacts on children are described, another finding from our work. So let's do more of that. The evidence is mounting about life course impacts from in utero through adulthood stages of exposure, cognitive deficits, behavioral problems, school performance, stunting, and other effects capture the public's imagination and attention, but we need to do a better job of quantifying those. I'm happy to report that at Vital Strategies, we're working in Indonesia to do just that with UNICEF as a partner. Last lesson I want to focus on is that cities can be incubators and drivers of national level changes. We know from actions around the 4x4 that air pollution in cities, that urban action, that city action makes a big difference. Air pollution in cities in the global south is worsening, populations are rising, energy levels are increasing, and impacts are rising as well. WHO, NGOs, and lenders need to focus on improving air quality in cities by empowering local actors, analyzing local impacts, and supporting initiatives that reduce local emissions. Actions in cities to elevate public concern are underway, both homegrown and supported from outside, but in many cities, more than half of all pollutants are emitted far outside the city, and even local emissions are not under cities' authorities to control. So cities should drive demand for national action, but they need help. We at Vital Strategies are completing an innovation guide for air pollution action by cities to help them harness recent changes in air monitoring technology, cheaper and more effective approaches for characterizing the key sources of air pollution and emissions, evaluate local authority, and set up multi-sectoral governance structures to act, as we've heard about is happening in India and elsewhere. We know many of you in the audience are involved as well, but we really need the international lenders and other actors to specifically support subnational action. And I just want to end by highlighting the fact that there are real differences between air pollution as a risk factor and the four previously focused on in the 4x4. First, health departments are really not well equipped to play meaningful roles in driving air quality improvements. We're so pleased that WHO produced its guidance for health sector engagement, but it needs to be implemented. Air pollution controls are implemented by energy, agriculture, city planning, transportation, environmental sectors, not public health. But we know from the 4x4 that public health concerns are essential for driving change elsewhere, like in taxation and marketing and in food production. So how do we do it? Well, we have to use the tools of public health: surveillance, health impact assessment, economic assessment. Health ministries need to calculate the true share of the costs of status quo air pollution to drive investment by government and rationalize the demand for expenditures by industry. Ministries can apply the tools of spatial analysis to help understand who is most vulnerable and who suffers most to prioritize actions on the greatest sources of air pollution. But to do this requires training and human resource investment in health departments and ministries. Although the good news is they're modest investments. A false dichotomy really exists in the minds of both the public and among elected officials that air pollution is an inevitable consequence of progress and that development efforts must trump public health. We must disabuse people of this notion. Wedding air pollution to climate change control and mitigation will help, and I'm going to leave it to our colleague from UNDP to help us think through best how to do that. So thanks very much.
Thank you very much, Daniel, for providing this useful insight. Now I invite Dr. Omar, please, from UNDP.
Good afternoon, ladies and gentlemen, and thank you, the organizers of this side event. It's very important, and I have a great pleasure to be with you today here. But to avoid repeating what the other colleagues in the panel just spoke about, and I would like to ask a question to the participants and to know how many of you are working in the other sectors like transport, energy, land planning, and agriculture. Just lift your hand. So, okay. So the answer is clear, and the air pollution problem is driven by the other sectors and the policies of the other sectors. And there is a need for multilateral action if the health sector to address effectively the air pollution and NCDs. That has to be clear. We need more other sectors people in this kind of events, because health sector is not the only contributor to the air pollution. I will talk about later on the health sector contributions. Secondly, there is a gap in terms of data on the economic cost on inaction on air pollution, as Nina mentioned it. And UNDP has been doing for the last 2-3 years a number of investment cases on NCDs on the behavior side, that is alcohol, tobacco, and lack of physical activities. We would like to expand that with other international partners and member states to agree on common methodology to measure what it means and in terms of economic cost on the inaction. Having said that, UNDP have been working closely with WHO and other international energy sector partners in implementing Solar for Health program, which I am overseeing it. In the last 3 years alone, we have managed to provide solar energy to more than 700 health facilities around the world. We have seen the impact that energy provided to health systems. The 3 key objectives or the mantra of the Solar for Health is saving lives, saving the environment, and saving cost. I will focus saving environment. We all know most of the health facilities are using either as a primary source of energy or as a backup system the diesel generators, and that contributes to the CO2 emission. And it's expensive. I just came back 2 weeks ago from field assessment in Liberia. Driving through those villages, every 2 kilometers you see trees that are cut and burned to use for charcoal. When we reach it in the health facilities, they are all running expensive diesel generators. In most cases, they have 2 diesel generators. One is standby in case the other one dies. When we estimated even the cost of one health facility to have solar energy, they will make that return on that investment in 1.5 years. But they don't have that initial capital to invest. It is easier for them to buy a few liters of fuel every day and contribute to the pollution. Secondly, we are running a program called Sustainable Procurement in the Health Sector, where we are trying to help member states manufacturers strengthening the supply chain of medicines and other health products. we hear that how many millions of people are accessing ARVs and TB drugs and malaria. But do we know what it means for the environment? From the packaging to the waste management to dispose those expired medicines. In Zimbabwe alone, we procure more than 700,000 ARV patients per year. And the country is currently treating almost 1.2 million people. That means 28 million plastic bottles of ARVs used per year. And that has a huge environmental impact. I would like to mention that the way forward, UNDP would like to partner organizations like UNEP and Vital Strategies, WHO, on developing a methodology to account for the environmental determinant of NCDs and look into the direct and indirect cost of the productivity loss and return on the investment and in the priority interventions. I will stop here and I will looking forward to interacting with you through the Q&A.
Thank you very much, Dr. Omar, for your insight. I will briefly just recap in 30 seconds what you have said. So, Nina, you have mentioned something important, like the systemic changes that need to happen. And this is, I think, something very important, because when we think about air pollution, we very often think end of the pipe. So this was an important message, as well as all the reflections that needs to be done on the taxes and how countries should use that. Dr. Agavar, you mentioned all the efforts that has been done in this huge country, this continent that is India, and all these efforts, and your country needs to be congratulated for all these efforts, which needs to be further extended, yes, and all the governance problem that come, because this is often the problem, the governance issue. Dr. Cass, you made a very nice a set of lessons on what we can learn from what we have done so far on NCDs, and this was very insightful. And all the communication, I think, is key, because communication is really the thing that we always come back to that. And this is important in this denier climate at the moment. And finally, Dr. Omar, this was very interesting to see all the already efforts that you're making on the ground with solar energy and energy access, and this is something that WHO is really keen to engage. Now I invite you, the panelists, to reflect on a few questions that will help the discussion. The first one would be, how can public health agencies help to build an evidence-based and investment case for strategic action to improve air quality for health? Is any one of you would like to? Daniel?
I'll start this off. I mean, I think my experience prior to coming to Vital Strategies was that I directed environmental health for a very large local public health agency in the United States, in New York City. And by large, I mean large. It was like 7,000 people. The environmental health group was 1,000 in and of itself. We figured out basically that the New York City's failure to act on air pollution, and in a really substantial way, was based on a couple of real problems. And we developed a strategy that took many years to implement, frankly. The first was to convince policymakers that there were health impacts at every level of at every increment in the concentration of pollutants. So if a city reaches attainment of its standard, it doesn't mean that there's not going to be improvement if it goes below that. And that was a really key message to work, and it took quite a long time to do it. We also realized we had really inadequate information about the sources of pollutants in New York City. We had a big regulatory function. We had lots of regulatory monitors, as many high-income countries and cities do, but it wasn't designed to inform local policy. And so with a modest amount of resources, we answered those questions by tweaking the monitoring system, by putting up additional monitors that would be capable of identifying really critical sources. And the third piece that we did was we quantified the impacts of emissions by those sources to move policymakers to pick the lowest hanging fruit over which they had local authority to take action. That's a typical set of functions that is not that difficult to do within a health department at a local level, or to think about doing at a health ministerial level, at a national level. But it requires leadership, it requires modest resources, and it requires, the cooperation of leaders. I don't want to pretend that this is something that everyone can just flip a switch and do. At the time, our mayor was Michael Bloomberg, who's sort of one of the principal funders of these kinds of governmental public health interventions. But nonetheless, there are a set of sort of core actions that are really well within the wheelhouse of most public health departments that really will sort of move action.
Thank you, Daniel. This is Nina, you want to say something?
Sure. Yes, thanks very much. I think one of the most valuable things that a public health department can do is join us in becoming advocates for air quality and policy coherence across whole of government. So all other departments need to be talked to. As Daniel said, regulation and legislation, we know from experience that these are the most effective things you can do, including the economic instruments as well. So across all levels of governance, if you're striving for this at the city level or at the local level, community level, there's a lot you can do, but without policy coherence at the national level or the federal level, without phasing out those subsidies that cause a lot of harm to health around fossil fuels or around high emissions agriculture, we need to make sure that it stacks up across the whole piece. And there's definitely a lot of reflection to be done and a lot of experience across the board in terms of regulatory design. So I used to work for an organization called Transport and Environment, and we were one of the campaign groups, advocacy organizations that discovered what was going on, which then became the Dieselgate scandal in Europe, and obviously was big in the US as well. So, the regulatory design and having also the capacity within the environmental agencies, the public health agencies, civil society to scrutinize your policy design, that it isn't shot full of loopholes by the vested interests of the industry when they're in the room negotiating what your standards look like, as Volkswagen and the other car producers were. That's absolutely essential as well. So I think there's so much that we can learn from what's been done well in different parts of the world, but also where we've fallen short already.
Thank you, Nina.
I think this question is most pertinent to me because I'm working in public health agency as well as also sort of this is one of my tasks to prioritize how do I make environment and health as part of some major activity in the field. And last 2 years of understanding will actually tell me that the three things which are very crucial to ensure that we build a case for investment in air pollution. First is very important is that we create awareness within the system that yes, it is a harmful thing, it is something which is harming us, primarily in terms of its long-term impact. Vis-a-vis short-term, we do not sort of perceive it as a major issue, but in long-term impact, if we do not start acting today, then future will not be able to manage it. So this is the type of awareness we need not create only at the national level. We need to create this awareness through proper and effective communication to all the states as part of our federal structure and take it down to the district level, to the lowest level, so that we create that case where the demand is generated within the system to act on it. Second thing is equally important is work in terms of creation of evidence specific to the local context. To give you an example, that when 2 years back I was trying to push this agenda within my own different multitude of activities which we are supposed to look after, I realized that when we found air quality index in Delhi becoming very bad, this provided us impetus in terms of media as well as other sectors coming along with Ministry of Health to take this agenda forward in terms of crop burning in and around the Delhi NCR region. And we found that this energy which was created because of getting required evidence, people were able to see the impact of it. We were able to launch our program with much bigger gusto. We were able to get more stakeholders involved into it. And within our ministry also, creating an investment case for environmental health became much easier.
Thank you, Dr. Aga.
Thank you. And I think I will say three things. First is we have to look at the health system as an advocate for the air pollution and NCDs. Though we don't create from the health sector any air pollution, or maybe less than compared to the other sectors, but in the health sector, we have issues, already existing issues, weak health systems that cannot generate data. So we have to look at how to strengthen that capacity in evidence from the routine data. The other type of data I think is also important is from the field research. And also it will be good if the health sector can look at its own specific air pollution data and to become a champion to advocate for that. The second is the capacity of parliamentarians and government institutions that has to come up with the right policies and decisions. We need to strengthen that and pay attention, because in this room even you can see there are not many other actors. And I think WHO and UNDP and maybe other and partners can play at the country level role to strengthen that capacity. Partnership is very critical. If we look at how the HIV/AIDS group put HIV/AIDS in the global agenda, we have to learn from that. So partnership is very critical to move forward and to convince policymakers. So thank you.
Thank you. In the sake of I would like, in the sake of time, to ask you a question that as WHO we receive very often. So what are the first steps that government can take right now to improve air quality without substantial increase in funding and resources? The question is, what are the some first steps that government can take right now to improve air quality without substantial increase in funding or resources?
I have an even better one. And that's one that saves money. So that's just strip back some of the subsidies on fossil fuels, for example. I mean, OECD, G20, G7 have already agreed that they're going to do this. The heads of state and government at those levels have committed. Fossil fuel subsidies are worth over $5 trillion a year. This is, what our governments are handing over basically to those industries, which is enabling them to continue to pollute on the one hand, but also, of course, that's keeping cleaner energy alternatives out. That's their incumbent position is entrenched by those subsidies, and this is something that could be done, could be decided. Okay, opposition to it notwithstanding, could be decided overnight in theory, and it would have, almost immediate impact on people's health as soon as that flows through to the system. So, then you have more money to spend on whatever you want.
Thank you, Nina. Dr. Agarwal?
I think if we can spend on prevention, then we probably need lesser investment in terms of management at a later date. So what is very important, again, I'll come down to my point of if I can create required awareness within the system. And we all know, I don't think, from second, third class onwards, all the children in their textbook, they all end up reading why pollution is caused today. So once we know that, how do we sort of using this particular knowledge translate into action as a preventive approach will really help.
Thank you. I guess we still have time for a question. So I will ask, the last question will be, what are some concrete steps government and civil society can take to improve public awareness and increase demand for cleaner action? Because I understand that without the demand, nothing will change. Does one of you want to take the bet?
Several things I would suggest. The first is that there are natural champions in most places to pursue air pollution, to really drive sort of air pollution advocacy. One thing many governments can do is stop suppressing them. Another thing that they can do is that public health sort of departments typically are quite skilled at communicating health messages. And so to the extent these apparatus exists within health ministries or local health departments, they should be essentially moved to deliver some of these messages around air pollution. Third, as I alluded to sort of in my earlier remarks, we need to stop talking about daily variation in air pollution. It's confusing, it satisfies, it quiets a public when all of a sudden levels go down, or half the cars are taken off the road with little impact, or we experience relief, or governments claim enormous credit for improved air pollution in a season where there happens to be more rain than the previous. So we need to be honest about what's going on. Finally, I think that from a communication perspective, we need to contextualize air pollution. Public imagination is captivated by novel things that are not sort of in their control. People expend enormous amounts of energy advocating for things with very little consequence, to be frank. We need to sort of think about how to talk about air pollution in a way that will captivate the public's imagination. The fact that it's the fifth internationally, in some countries, third leading cause of death, the fact that it stifles children's development, these are things that we really, I think are really critical messages.
Thank you, Daniel. Nina, you would like to respond?
I just wanted to add, show us what works. Show the public, car-free days, what happens to your health on a car-free day? What happens to people who have respiratory conditions on a car-free day? You feel better immediately from personal experience, but also people who have cardiovascular conditions, the benefits of even traffic being restricted on one street, if you walk down that street on a daily basis, the benefits are immediate. There were some BMJ studies to look at that if you just restrict traffic within a localized area. So same day benefits, this is incredible. So show us what happens, get the media to cover the personal stories of people who are otherwise suffering from asthma, suffering from other respiratory conditions in their daily lives, and what a difference it means to them, but also show the population level benefits as well. How much more productive can we be? What does this mean for kids that they can now go and more happily play outside? There are a couple of really good examples that have come through that research I mentioned earlier from FIRS, the Forum of Federation of International Respiratory Societies. They looked at a case in Beijing. So before the Beijing Olympics, obviously there was an air quality crisis, and they even had athletes like Paula Radcliffe saying that they didn't want to go because they knew it would have long-term as well as short-term impact on their health. So they decided to restrict traffic. They took some local measures for a while, which had that immediate benefit. But also, they found that when they looked at birth weights, average birth weights in Beijing of children that were, in gestation during that period, it had had a positive population-wide impact. So I think, once these messages get out, also the lives that have been saved in London by the congestion charge, it's unrefutable that people wouldn't want to do it.
Thank you, Nina. Yes, Dr. Agarwal?
Thanks a lot. Working in health ministry, one advantage is that even if you're an engineer, people tend to call you a doctor. So, I'm a career bureaucrat. A few years back, I was posted in education department, and everyone thought again, I'm an educationist. So, it always gives me pleasure to hear doctor, though. Very technical department. Having said that, see, what is very critical is that I'll take from what you said, that public health or government has enough capacities to create awareness. I probably would say that this needs to be supplemented by civil society organization. You had used the word that don't suppress. I would rather say not only suppress, remove the suspicion. So when a civil society organization talks about it, if we can create that partnership through which we can collaboratively work and go to masses, then the required demand can be generated. I have very firm belief, having worked on field for last almost 2.5 decades, is that if vis-a-vis a government employee, the best of government employee, communication from him, and instead of that communication from not even a so good of a civil society organization, I think civil society organization communication goes much faster and better to community. So it is very important to engage civil society organization, make them partner in your delivery process, and ensure that we are able to create that demand.
Thank you to all of you. Now, I think it's time to open the questions to the floor. So please raise your hand, and you will have people with microphones coming to you. I think I see one here on the right. Can you please say your name and country and institution? Thank you.
Okay, this is better. Hi, I'm Richard Greenwood, the founder of Radicate, a UK clean air technology company. Firstly, Dr. Agarwal, we're in the process of setting up a centre of excellence for clean air technologies with the University of Bolton. It's quite unique because we're actually looking at identifying, innovating, qualifying, and then globalizing the very best technologies to deal with indoor and outdoor air pollutions. We're already dealing with a company in India. We're helping to globalize their technology. And we're also very active with an organization called Smogathon, which is an international competition for the very latest clean air technologies. So it might be good to put those center of excellences together. You know, there will be student courses and PhD students and things like that, really developing the latest technologies. Secondly, Nina, you mentioned upstream solutions. I think this is really important, but I also think equally as important is to implement technologies right now that can go into buildings, that can go into homes, that can really alleviate immediate causes of air pollution. We're an indoor generation. A lot of air pollution is created indoors. We seal our buildings up for energy conservation, and we need to turn in some stance to technology to help alleviate what we're creating naturally. I started my company because my father had an NCD, he had COPD, and I looked at what technology was available on the market and didn't find very much, just filters and boxes. So there is technology available now, and I think it should go hand in hand with long-term solutions. That's all. Thank you.
Thank you very much.
You want us to respond?
Yes, please. Please. Rather short.
I think, you raised a very pertinent point. The role of technology and in terms of new innovations is going to be crucial when it comes to air pollution. Do kindly let us know what you're doing and how we can sort of integrate it into our process. We will be looking forward for that.
I see one hand here in the middle and one on the back after.
Hi, my name is Nadia Cobb. I'm with the University of Utah, sadly in the US. Probably shouldn't say that too loud. Anyway, thank you for a very stimulating conversation. I do have a couple of questions. One, they're both very brief. One is, this conversation has been going around in health and all policies for quite a while, and I'm starting to see many silos, once again, of people doing amazing work when I guess my question is this something that could actually come together in groups to consider, with health and all policies as an example? And then the other is kind of the upstreamist approach of looking at training health workforce. I know the push, obviously, in social determinants of health is grand, but you try to convince medical schools and other health professional educations schools that these are really important things for future caregivers to know and to deal with and to lead on, is virtually impossible. So I'd love to hear more about those kind of thoughts. Thank you.
Does one of the panelists would like to respond to?
So thanks for those thoughts. I think they're very pertinent. I mean, a couple of quick thoughts about the health and all policies notion. The idea sort of being that the decisions made sort of outside the health sector are the ones that influence the health of the public most, right? So whether that's in development or energy or in transportation or in the way cities get designed or sort of roads placed, these things have they have consequences, many times negative, potentially quite positive. So the idea is, why don't we consider sort of the downstream health benefits or impacts sort of at the outset? And I would say, just as a sort of former longtime government official, that I think that we shoot ourselves in the foot a little bit when we talk about health and all policies, because frankly, the tools aren't there to analyze the complex interactions for all of these decisions. The good news, though, is for air pollution, they're really clear, and the tools are there. And so it's very straightforward to basically turn activities into emissions, emissions into concentrations, concentrations into impacts. And one of the things that I've noticed in sort of moving from local to international work is that there are very few places in which these kinds of analyses are required. Cheap things to do for governments, mandate this kind of analysis for big efforts, so that it isn't done after the fact, so that policy options can be weighed against each other for their potential impact. So I'm in agreement. I struggle with the sort of, in some ways, the overpromise of the all-word policies, but I do think, especially around things that impact air quality, they're really quite important. And I just want to also say, I think your point about educating healthcare practitioners is really critical. Everyone knows that, environmental health maybe gets a half an hour in a 4-year medical school curriculum, if that. I would invite any clinician in the group in this room to take a look at our this new coalition network that we've created at Vital Strategies called Inspire Health Advocates for Clean Air, where we're providing grand rounds materials for people to use in medical school curricula, postgraduate education, to try to get practitioners aware of these issues.
I think there was a question on the back. I don't know if okay, fine. And then there are 2 questions here in the front row, 2 here.
I'm Paul Jensen with the International Union Against Tuberculosis and Lung Disease. Actually, sort of similar to the previous question. The recent FERS systematic review showed that air pollution affects virtually every organ in the entire body. So as it relates to coalition building, it seems that there's a huge opportunity to build an advocacy coalition that spans various health disciplines. So I'm wondering sort of what does this review mean for, say, the next several years of advocacy coalition building within the global health community? And then related to that, like we have a strategy framework, DOTS for tuberculosis or Empower for tobacco control, is there a similar strategy framework for air pollution somewhere on the near horizon? Thanks.
Yes, Nina, you would like to respond?
I think the last part of that question was for you, actually. But I'll take the first bit if you want. And great. I want to respond quickly to what Richard asked about upstream solutions and indoor air pollution. I think rather than mandating a specific technology or solution, because this will always move on, it would be important to talk about indoor air quality standards and ceilings, which I know, I'm not sure about other parts of the world, but the European Union has been dithering and not doing that for years. So that's, I think an important thing to consider is what kind of industrial, economic development, innovation, entrepreneurship opportunities that would open up for companies like yours with technologies that you mentioned. I think, this is all part of the Green New Deal dialogue that we need to be having everywhere, essentially. So I would be very supportive of talking about indoor air quality standards as well as outdoor, which we have in many parts of the world. Well, Nadia mentioned about hooking up with other kinds of campaign groups. I think that's really, really important. I think there's quite a decent interface between the environment and the health groups. But where we could certainly do better is talk to the groups that are working on just transition. So like the social movements, social equity, because what we're all talking about at the heart of it is the rights agenda and the right to good health for everybody. So I would love it, and if we can make outreach to like social movements to make sure that also this deal has just transition in it for people that are working in those sectors as well, so that we make sure that there aren't unintended consequences and people that lose. And then, I don't know if you know the work of IFMSA, the medical students, they're here en masse and they're phenomenal. That's all I would say.
Regarding can you just repeat the end of your question, please? Well, the resolution and the roadmap on air pollution is rather new, so there will be clearly a need to redefine the strategy and the roadmap for the years to come. So this is ongoing work, yes. But for the moment, this is not. So the roadmap that we have had is very global and general. We focused a lot on raising awareness, on strengthening the evidence. Further developing the evidence, and the next step is, of course, the economic case and interventions, and how to further engage the health sector. Further question? There were a question here. Yes.
Anja Lietz. Anja Lietz from the German Alliance for Climate Change and Health. And just to share with you that in Germany, several cities are failing the air quality standards for Europe. And of course, there are a number of court cases. And even though one would think evidence exists, we've been challenged by the evidence on air pollution. So while I think evidence is one thing, the other thing I can really support is that whole debate on communicating and bringing the personal story, because as humans we relate on an emotional level, and as more as we engage with media and can share their stories and how it helps individuals, that would be really useful. So, and from that regard, would be really interesting to hear from other campaigns that we can also share our experience and learn from another.
Thank you, Nina. Yes, does one of you want to say something about the comment?
Right. Just to agree, I think there's so many city-level campaigns in different parts of the world as well that we can also hook up with and make sure that their voices are heard in forum like this, like WHA. There's Clean Air for London, there's Brussels Clean Air Action, phenomenal all over the place. So I just to agree with what Anja just raised, that also from that local level up to the global and vice versa, that we keep each other informed of opportunities. So I'm not sure how many of them are aware of 5x5, for example. So yeah.
Yes, and to come back on the controversy, I think this is also linked to the this current challenge of climate change and air pollution deniers, and there is really a need for the scientific community, the medical community, to really come in one voice and to really be prepared and prepare your message, have a consistent voice, and all the evidence that has been building over the last 30, 40 years on air pollution and health needs to be carefully communicated. This is very important because scientists tend to focus as a scientist to communicate on the uncertainty that links, and we have to be very careful how we communicate. We need to communicate much better what we know and how does it impact. And I think what we have heard today was very interesting. Any further question?
Yes, this is Ibtihal Fadel. I am the president of the Regional NCD Alliance in the Eastern Mediterranean region. Thank you for the panelist. It was very interesting. I want to raise some thought here. As a public health professional, I do strongly believe in multi-sectoral action and the action of beyond the health ministry, especially when we talk now about non-communicable disease. But what is worrying me now when we extended the 5x5 agenda, although I strongly agree with it, but we are still struggling on a local level with many countries to changing behavior related to the NCD risk factors. Now we're adding the air pollution on the top of it. Unfortunately, I should say, most of the country are really not ready because the air pollution is much, much beyond the NCD risk factor. These could be, yes, we agree of the other sectors, but these are a behavior which could be managed and changed by different solution. But if we look to air pollution, there is a lot of solution which I read here. I think it is a sustainability of life. I mean, you cannot ask some poor country to do change in, like fuel, changing in the transport, and they are very poor country. So these are matter of sustainability. So the action would be even stronger when we added this air pollution. And this is why I'm raising a thought here. We have to differentiate between what is a necessity and what is sub-necessity. There is a difference between these two levels. So the solution has to be accommodating the different level of what country have to do now and maybe to maintain life, and what can be done to as regarding behavioral or changing, which can be managed. Thank you.
Thank you for this thought. Do one of you wants to comment or add?
Maybe I will put it in your words, we need a prioritization of actions, but I don't think the air pollution issues is less important than the other NCD issues. And multi-sectoral approach is the way to go, and the world has that experience. We have done in many diseases, and this is why it should be different. We need to talk to the other sectors who are driving these policies. It's a bit more work from the health point of view, but if we provide the evidence, the knowledge, and what is wrong, and how we are polluting, and how this pollution is affecting our health, I think we can make a major improvement. But if we just now start saying, you know, this is not important, and I think we will be going in contradiction of our actions. But I agree with you to say we need to prioritize the actions, what needs to be done with other sectors beyond the health sector. Thank you.
And I just want to comment. I appreciate how difficult this is. It's sort of piling on, additional work responsibility, expecting the health sector, the public health sector, to take sort of all of this on its own is not, I think, what we're advocating. I do sort of I can't remember your name, but in sort of thinking about this notion of health and all policies, I think we also have to think about what the true counterfactual is, what the future is going to look like if we don't act. The population, the growing urbanization, rising populations in cities, and rising energy demand and use without very substantial intervention on both sort of air pollution goals and climate goals will be disastrous. I was just looking at the global burden of disease data just for a country yesterday, and I was looking at the sort of comparing the trends in air pollution levels. Average levels for the country, which were entirely flat over the last, sort of many, I think 20 years in this country. Flat reflects to some extent something positive because the population has grown and emissions have largely stayed the same. On the other hand, because the reality is that when the population grows dramatically, more people are exposed. The curve on the number of deaths annually attributable to air pollution in this country was one of the steepest curves I've ever seen. That's what we're looking toward. If we don't act now, decisions will be made around how to deliver that energy, will be made around how to plan our cities or fail to plan our cities. And we need to be thinking not only about the future, not only about like what to correct about the present, but how to manage the future.
Thank you. I think now we can close up, and we welcome Sandy to make the concluding.
Yeah, so I just, I think some terrific remarks were made as we were closing the panel and this afternoon's session. I'll just say one thing, and I say this from wearing my strategic communication professional hat, that just as we have made enemies, appropriate enemies out of alcohol, sugar, fat, salt, tobacco, I think we need to think about this issue, this catastrophic issue, as also having very deliberate and intentional actors who are working, as Dan said in his remarks, to make us unhealthy. And I think that there needs to be more outrage around this issue. We need to think about maybe even the other disciplines that we've been working on for much longer, and to see if we can take some of the lessons that we've learned in villainizing these other industries and to sort of do the same thing within the space. So really appreciate all the provocative remarks that were made, all the terrific presentations, and thank you so much for moderating this panel. And thank you all so very much for coming. I was going to say that there's food and so forth outside, but it's all gone. So just enjoy each other's company, and thanks again for participating.